Your Excellency, the Prime Minister of Ethiopia, Your Excellency, the President of Djibouti, Your Excellency, the President of Botswana, my brother Michel Sidibe from the UNAIDS, my dear sister Vera from UNECA, Halima, my daughter representing Hali Dangote, the organizers of this meeting, colleagues, ministers present here today, my own brother from Kenya, the minister responsible for ICT, Joe Mucheru. Ladies and gentlemen, I bring special greetings from His Excellency President Uhuru Kenyatta, who would have liked to be here but had to make his way back home last evening. Allow me, therefore, to share his thoughts with you this morning. And I start by congratulating the African Union and the Africa Business Council on the occasion of the launch of the Healthcare and Economic Growth in Africa report, recognizing that ultimately investment in health have an influence on macro and microeconomic conditions of any country. Health is therefore a determinant of the economics, the social and political aspects of development, and that in Kenya we believe. However, allow me to recognize that sustained investments are required to leverage on gains that the continent, and indeed Kenya, has made during the MDG era, and to ensure targets that were not achieved then are fast-tracked as part of the SDG aspirations. The SDGs represent a fundamental paradigm shift and acknowledge the role of various partners in the transformation of people's lives, and in particular, in delivery of quality and affordable health care. In particular, philanthropic interventions are becoming an effective contributor to sustainable development, creating value for both business and the society. This alone isn't enough, however, and we need to move into sustainability. Thus, efforts to take philanthropy to scale and to turn business into truly transformative force for health should be encouraged. The government of Kenya recognizes the important role of public and private partnerships in complementing partners' resources as well as government resources in healthcare delivery. In Kenya, my president would like to say, we do not struggle in welcoming the private sector to support us in delivering public good. And it is for this reason that we have continued to work on the ease of doing business, and are proud to recognize that only last year we managed to move to the 61st position, having worked our way through from 129 out of the 190 countries ranked in the year 2013. The public-private partnerships in health have catalyzed progress towards attainment of universal health coverage in Kenya. The private sector has made investment in different priority areas of the health system, ranging from risk pooling, outpatient and inpatient care, retail, pharmaceuticals, health education, nutrition, diagnostics, logistics, and the list continues. Currently, we have $4.5 billion invested by the private sector in our health sector. It is projected in a survey conducted last year that we can grow this in Kenya to upwards of $11 billion in the next 10 years. With a double burden of communicable and uncommunicable diseases, it is clear to us in Kenya that we need to mobilize private sector resources to support the efforts that we are making. I'm happy to note that, for an example, we have leveraged private sector innovations and attained accelerated and improved health outcomes through the Managed Equipment Service Program, launched by His Excellency the President 4 years ago, where specialized medical equipment has been outsourced from private providers. This has led to equitable access of specialized services such as renal dialysis, intensive care services, theaters, and therefore surgeries, diagnostics, all available at the very hard-to-reach local areas in Kenya. These equipments in which we have also ICT capacities also enable sharing of limited specialists across the country, where results are able to be shared and feedback given to patients in the rural areas. It looks like I am under pressure to leave. But I'll give a few other examples. One where we have partnered with a group of private sector pharmaceutical industries cooperating to build the capacities of halting and reversing NCDs using SDG 17 on strategic partnership as their entry point into my country. Ladies and gentlemen, excellencies, the Kenyan story may go on and on and on, but I do recognize there's pressure for time, and therefore wish to leave the following for us, that as we recognize the great opportunities that come with the private sector in Kenya, we also recognize significant challenges that may require to be addressed to ensure health equity. And in here, we're looking at issues to do with quality, and therefore we have to up the standards of quality monitoring and feedback to the private sector. We also have to look at issues of having a sound legislative and policy framework that then would support sustainability of private sector investment in Kenya. We do also recognize the need for us to have frameworks that allow for continuous and coherent consultations with the private sector. But finally, I wish to conclude by saying that Kenya is cognizant that the private sector is not just to be taxed, but can also engage in shared value solutions for development. And as we go through rebasing of the Kenyan economy, the government is open to discuss with the private sector additional business models and social impact investments that will improve health service delivery in Kenya. And it is for that reason that we have set a consultative framework as a country at the technical level, at the ministerial level, where I chair with the private sector a ministerial forum to look at what the private sector is running through, the opportunities, the challenges they are facing. And this leads on to an apex conversation where His Excellency the President chairs a roundtable, presidential roundtable, we call it, where all the issues that afflict the private sector are debated. We recognize it's only by harnessing the strength, the resources, and the expertise of the private sector, and coupled with additional investment by the government, can we uphold the current health gains and achieve lasting and sustainable health solutions in Kenya and in Africa in general. Next time, I will be a bit more brief, but I want to congratulate the brains behind this initiative. It will count for much. Thank you.